You're welcome to another exciting topic on EHS310, control of communicable and non-communicable diseases. My name is Frank Eromoseli Ewudare, and I am your facilitator for this course. So, let us begin. EHS310, control of communicable and non-communicable diseases. My name, once again, Frank Ewodage, and that is my email address in case of any inquiries whatsoever. So, for today's class, we shall be discussing the introduction to non-communicable diseases and their disorders. And at the end of the class today, the student should be able to define and classify non-communicable diseases. The students should be able to understand the epidemiological patterns of non-communicable diseases and also should be able to enumerate the risk factors for non-communicable diseases. So, what do we understand by non-communicable diseases, NCDs? Non-communicable diseases are those diseases that are responsible for the death of 41 million people annually. In other words, 71% of of deaths that occur globally are caused by non-communicable diseases. 15 million people aged between 30 and 69 years usually die from non-communicable diseases each year. That is, and most of the time, 85% of these deaths usually occur in low and middle income countries. Cardiovascular disease account for the most non-communicable disease deaths annually. That is the truth. Cardiovascular disease such as hypertension are responsible for 17.9 million people dying annually, followed by cancers, respiratory diseases, and even diabetes that is responsible for the deaths of 1.6 million people annually. So we have seen the figures of we have seen all these figures. All these are figures that represent the severity of non-communicable diseases. So what exactly do we mean by non-communicable diseases? Non-communicable diseases are defined as those chronic conditions that do not result from an acute or infectious process. They are those chronic conditions that do not result from an acute or infectious process. They are also defined as diseases that have a long or prolonged course that do not resolve on their own and for which a complete cure is rarely achieved. That is, it is almost impossible for one to have a complete cure for non-communicable diseases. They therefore have the following characteristics. You know that for communicable diseases are usually caused by disease-causing organisms like mycobacteria and like microorganisms and other examples. But for non-communicable diseases, there are factors that are responsible, and they have these following characteristics. They are complex etiology, that is, the cause of non-communicable disease is not tied to a particular cause. It is a mixture of many causes. They have multiple risk factors, as we're going to discover later on. They have long latency period. They have non-contagious origin, um, prolonged illness, and functional impairment of disability. Now, let us discuss the classification of non-communicable diseases. Non-communicable diseases are classified into the following: cardiovascular disorders, such as hypertension, coronary heart disease, heart failure, stroke, and so on. So when you hear cardiovascular disorder, you are simply talking about diseases that affect the heart and its blood vessels. Second category of non-communicable diseases are respiratory diseases such as chronic obstructive pulmonary disease, asthma, and so on. The third category are the cancers, then followed by diabetes. Then there are some other categories that that occur, but they are not usually limited to the four that we just discovered, that we just discussed. These include blood disorders such as anemia, sickle cell disease. Then another one is renal diseases such as chronic renal failure, neurological disorders such as dementia, and unintentional injuries such as road traffic crashes. All these are also examples of non-communicable diseases. In the next slide, there's going to be a class activity. Please take a full moment of your time to attempt the activity. So let us go ahead and continue our conversation, our discussion. The next thing we're going to talk about are risk factors. Risk factors. So we're discussing the risk factors for non-communicable diseases. The risk factors for non-communicable disease are many actually, and because of that, they have been categorized into different types, into modifiable risk factors, and non-modifiable risk factors. Modifiable risk factors and non-modifiable risk factors. Modifiable risk factors simply means those risk factors that can be altered, that can be changed, so that when you change them, the chances of one coming down with the disease are very, very reduced. The chances of one coming down with diseases are reduced if one has um, if one modifies the risk factor for that disease. Then non-modifiable risk factors are those risk factors that cannot be changed. They are there and they cannot be altered for whatever reason. So examples of modifiable risk factors, that is those risk factors that can be altered so as to improve health outcome include tobacco use. Tobacco use is a modifiable risk factor in the sense that if one if it is available if one is used to smoking tobacco and its products previously, and he now understands that tobacco use is associated with lung cancer, then and then he now decides to stop taking the tobacco, then that is actually a modifiable risk factor. He has stopped taking tobacco or he has stopped using its products, and therefore the chances of him coming down with lung cancer becomes significantly reduced. Other modifiable risk factors include physical inactivity or sedentary lifestyle. That is somebody who usually sits in one place at a particular time. Because of that, the person can become overweight or obese, and overweight and obesity have been associated with development of metabolic disorders. So instead of staying in one place, the person now becomes more and more physically active, engages in vigorous exercises that can help delay the onset of metabolic disorders in such human. Another modifiable risk factor is healthy diet, unhealthy diets. Unhealthy diets for people who usually consume large, their diet is usually composed of carbohydrates and the bad fat, the low density lipoproteins and cholesterol and so on. So if a patient modifies the diet, the chances of developing blood vessel diseases, okay, become significantly reduced. Then of course, harmful use of alcohol. when somebody abuses alcohol, because we all know that alcohol damages the liver and all that. And so, if a patient stops taking alcohol, then the chances of coming down with a chronic condition will be significantly reduced. The next slide will also reveal another activity that you're expected to participate in. So please take a few moments of your time and carry out the activity. So let us now discuss non-modifiable risk factors. These are risk factors that cannot be altered for whatever reason. Once somebody has it, the person has it for life. It cannot be altered. The first one is age. Age. As one grows older, the chances of developing some age-related diseases become high. Therefore, one cannot alter his age. Okay, one can simply alter his age. We also know that with age, a human being becomes more predisposed to developing cardiovascular diseases such as hypertension. So age is a risk factor for hypertension that cannot be changed. Another one is gender. There are some diseases that are gender related. For instance, in females may have cervical cancer, endometrial cancer, breast cancer. So these are diseases that are related to gender. Then on the other hand, for males, a male can have bladder, urethral cancer, and prostate cancer, and so on. So all these are diseases that are gender specific. Then, of course, race and family history. All these are risk factors that cannot be altered. For somebody who has a history of cancer in the family, it cannot be changed that the person has history, or the fact that person has somebody in the family has had a history of cancer. That essentially lives in that particular family line. It cannot be altered for whatever reason. So other risk factors that we know about include metabolic risk factors, and they compose of raised blood pressure, overweight or obesity. This can lead to some metabolic cancers, hyperglycemia, and hyperlipidemia. All these are risk factors that can lead to non-communicable diseases. So this is the end of today's class. Until next time, I remain your facilitator, Frank Iramaseli Ewodage. Thank you for watching, and it's goodbye for now.